Do you or someone you know struggle with schizophrenia, bipolar disorder, irritability associated with autism, or major depressive disorder? If so, Abilify might be for you. Abilify is the trade name for the generic medication aripiprazole. Abilify is a second-generation antipsychotic drug otherwise known as a mood stabilizer. Abilify works by enhancing and/or inhibiting dopamine and serotonin levels in order to balance the levels of these neurotransmitters within you. Abilify is thought to be a dopamine-serotonin system stabilizer. As an antipsychotic, the FDA has approved Abilify for a number of different uses. These uses include decreasing manifestations of schizophrenia, decreasing mania in bipolar patients, decreasing symptoms of depression or major depressive disorder in combination with antidepressants, decreasing agitation associated with schizophrenia or bipolar disorder, decreasing emotional and behavioral symptoms of irritability, and decreasing incidence of tics. Abilify can be administered as a tablet or oral solution for most indications. Intramuscular injections are only available for treatment of agitation associated with schizophrenia or bipolar mania. Abilify comes in dosages of 2, 5, 10, 15, 20, and 30 milligram tablets. Patients should consult their doctor about how and when to take Abilify. People taking Abilify should not stop taking Abilify or change how they are taking this medication without first consulting their physician. Abilify is approved for use in treatment of major depressive disorder in combination with other antidepressants such as Zoloft, Wellbutrin, Prozac, and Lexapro, though data on FDA approval for combination usage is limited. Off-label uses of Abilify include use for insomnia, delusional disorders, and anxiety spectrum disorders. Abilify was once marketed to seniors suffering from dementia and Alzheimer's disease as an off-label use. Abilify settled a lawsuit for these allegations as Abilify was not approved for use in treating Alzheimer's or dementia. Common side effects of Abilify include nausea, vomiting, insomnia or difficulty sleeping, compulsive gambling, compulsive shopping, hypersexual activity, suicidal thoughts, weight gain, or uncontrollable body movements otherwise known as tardive dyskinesia. As an atypical antipsychotic or second-generation antipsychotic, Abilify carries a decreased risk of movement disorders and higher risk metabolic side effects, such as increased blood sugar measurements, increased blood pressure, and increased cholesterol. Abilify has 2 black box warnings. Use of Abilify may cause suicidal thoughts in young children, adolescents, and young adults. Elderly patients with dementia may also be at increased risk of death if they take Abilify. It is recommended that those taking Abilify avoid operating heavy machinery or driving until it is determined how Abilify affects them, as Abilify is known to cause drowsiness. Please consult your doctor if you are suffering from any of these 2 black box warnings. Abilify is known to interact with a number of drugs, including those prescribed for hypertension, benzodiazepines, specific antibiotics and antifungals, antidepressants, and anticonvulsants. It is recommended that you consult your doctor and pharmacist about all the medications you are currently on before you begin taking Abilify. Abilify is currently combating a number of lawsuits relating to the serious side effects of Abilify, including the compulsive disorders that have led to serious gambling problems. However, if you are eager to control your aggression, mania, or depression, Abilify might be the right option for you. Call your doctor to ask about Abilify today. Don't miss out on any more of the little moments in life. Take control of your depression and aggression today. Abilify.